it's Dr. Pat at Little Critters, and we have a special treat for everyone today. We have Buttercup and Gizmo with us, 8-week-old baby bunnies, and these are adopted to a wonderful, loving home, and were brought in for their health check and a follow-up, and we have some rhinitis, some chronic nasal discharge that's occurring. We look at these beautiful little noses. You'll see some dried discharge on the side of the nose here. And Gizmo was sneezing pretty copiously during the exam, and Buttercup wants to visit. And if you look at Buttercup, you can see we have some food debris, but also we have some dried nasal debris, and she's had some sneezing as well. It is a very common thing that we see. Rabbit snuffles is what we typically call rhinitis in rabbits, which is just inflammation or infection in the nose. People typically will think of it as Pasteurella, and that's one potential cause, but any bacterial infection can cause nasal discharge in these young baby bunnies. And so we are going to go ahead and treat these guys for a bacterial rhinitis. I typically will do penicillin G injections. It's important to note you cannot give penicillin orally to rabbits. Penicillin or derivatives of penicillin are fatal if they go through the gut because they kill off the good bacteria, and then we have an overgrowth of the bad bacteria that release endotoxins and can be deadly. So we would never give that by mouth. But by injection, we can give it as a once-a-week depot injection. It's very effective in most cases for rhinitis and very safe and friendly to the GI tract. So we're going to get these guys started on that right away and make sure we get their noses cleared up. What we don't want is for these nasal infections to become chronic infections, because over time, as these continue, then we end up with scarring and constant inflammation in the nose, and the filter in the nose can be damaged so that we don't filter out just kind of the run-of-the-mill bacteria as well as we should. And then that leads to susceptibility to other infections down the road. It is something we want to clear up as soon as possible. If you see a sniffly, sneezy rabbit, you don't want to let that go. So these guys are off to the right start with a wonderful, loving, adopted home, and we'll get them back to normal. The other important thing is we do want to get them started on RHD as soon as they're feeling well. We need to make sure there's no fever because we don't want to fight another infection when we vaccinate. RHD is a rabbit hemorrhagic virus that is fatal to bunnies. Baby bunnies, just like baby puppies and kittens, should be vaccinated and must be vaccinated to prevent life-threatening diseases. RHD is an epidemic. It is in the wild rabbits, and you can track that inside just with your shoes. So it is something that even a house rabbit should be vaccinated for. And then the last thing is we do have a boy and a girl here. And so it is important to get your baby bunnies taken to the vet and sexed, because oftentimes we look at these beautiful ones and we think we have two little girls and we had a surprise little boy here. And it is very important to get them spayed and neutered because they will be reproductively active very early and can surprise you with an early litter. So once we get their noses cleared up, then we'll get them scheduled in, get them a little bit bigger, and get them spayed and neutered.